Are supplements worth trying for mental health? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and this is a question that's come up in some recent videos. Now, if you've watched some of my other videos, there certainly are a few supplements that I do recommend for mental health. Things like magnesium, vitamin D, omega-3 fatty acids, melatonin. But there are a whole lot of other supplements that are marketed for mental health conditions that I haven't talked about. And obviously, I'm not going to talk about all of them in this video, but I do think that it's an important conversation to have. I think there are two sides of this debate. On the one side, the Western medicine side, the pharmaceutical industry, although regulated in some capacity, does not have the same strict regulations and research requirements as pharmaceuticals. And so for that reason, in many cases, we do not have as much evidence to show safety or efficacy of these supplements. And so it's important to keep that in mind, to be just as cautious with supplements as you would be with a pharmaceutical agent. Just because it's a supplement or natural does not mean that it is necessarily safer than a pharmaceutical. Additionally, it's important to keep in mind that a lot of supplements do have interactions with some other medications due to the way that they interact with your liver enzymes. And so it's important before you start any supplement to talk with your medical provider and check it with all of your medications to make sure that it's safe for you. On the other hand, there certainly are a lot of people who have had significant benefit from supplements. And there are a lot of supplements that are relatively low risk and could provide as much, if not more, benefit for a patient than medications that have a significantly higher number of risks. Patients often also enjoy the ability to have a little bit more agency. They can just go to the store and buy something and try it and make their own decision about it rather than requiring a prescription from a doctor, having to wait to see them for an appointment, etc. And we definitely can't underestimate that the role that a patient's belief in an intervention can have on its potential success. So if someone thinks that this supplement is going to be the answer, it often is not, but there certainly is going to be more buy-in and therefore a greater chance of a good response. There definitely are some supplements that can be helpful for people for mental health indications. And if you want to hear me talk about any specific ones, then put them in the comments below. But in general, if a patient is interested in trying a supplement, I'm going to check it against their medications and make sure that there's no contraindication. But if there's no real safety concerns on my part, I encourage a patient to explore and see what works for them. I think that having prescribers on board, like myself, is a much better way to go about this so that we can monitor and see how a patient is doing and intervene if anything bad is happening. If there's been a supplement that you found particularly helpful or harmful to you, I'd love to hear about it in the comments below. Additionally, if you're interested in getting more direct resources and content from myself, I do have an email list and I'm sending out bi-weekly emails. So if that's you, then send me a DM with your email and I'll see you in the next one.